Welcome to the latest edition of Hematology Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. EMA's SAWP confirmed that Cellectar's Iopofosine I-131 for post-BTKI refractory Waldenstrom macroglobulinemia is eligible for a conditional marketing authorization filing, with PRIME in place and CLOVER-WaM Phase 2 cited. The company plans to move forward, positioning Iopofosine Y-131 as a potential option for patients with few remaining therapies, while aligning next steps with ongoing evidence generation and post-authorization commitments. FDA accepted the BLA for Orca-Bio's Orca-T to treat AML, ALL, and MDS, granted priority review, and set a PDUFA date, based on Phase 3 Precision-T showing improved survival free of moderate to severe chronic GVHD versus standard allo-HSCT. This positions Orca-T as a differentiated allogeneic cell therapy candidate, pending full review, with attention on durability, safety profile, and potential impact on transplant practice. CSL Behring signed a letter of intent with the Pan-Canadian Pharmaceutical Alliance for Hemgenix, enabling provinces and territories outside Quebec to proceed with public listing decisions for adult hemophilia B. The agreement can accelerate access by supporting jurisdictional formulary evaluations, aiding centres as they plan screening, initiation, and long-term outcomes tracking. A follow-up item reiterates that Iopofosine I-131 remains eligible for a CMA filing in post-BTKI refractory Waldenstrom macroglobulinemia, with timing unchanged. The regulatory pathway continues to be aligned with prior scientific advice, reinforcing confidence in the submission strategy and the supporting dataset. A follow-up item reconfirms Orca-T BLA acceptance and priority review with a PUFA date set. The review remains anchored on the Precision-T outcomes, emphasizing survival free of moderate to severe chronic GVHD, and will assess benefit-risk balance alongside established transplant standards. FDA granted breakthrough therapy designation to B1 Medicine's sonrotoclax for adult relapsed or refractory mantle cell lymphoma after BTKI and anti-CD20 therapy, accepted into Project Orbis, based on Phase 1-2, BGB 11417-201, with Phase 3 Celestial RRMCL underway. The designation underscores the potential of this BCL2 inhibitor in a high-need setting, focusing development on speed, collaboration, and clearer endpoints. FDA granted orphan drug designation to Minovia's MNV201 for myelodysplastic syndrome, with Fast Track already in place in EMDS and RPDD Plus Fast Track in Pearson syndrome. This strengthens the regulatory support for a mitochondrial cell therapy approach in hematologic disease, signaling commitment to rare conditions where options remain limited. FDA accepted Rocket Pharmaceuticals' resubmitted BLA for Kresladi for severe leukocytes, site adhesion deficiency type 1, with a PDUFA date set. The sponsor reports 100% survival at 12 months post-infusion, fewer significant infections, and a generally well-tolerated profile in a global Phase 1-2, supporting the resubmission and informing real-world readiness plans. Novo Nordisk and Omeros announced an asset purchase and license for the MASP-3 inhibitor zaltenibart, with Novo obtaining global rights, and the deal valued up to $2.1 billion in upfront and near-term milestones, while Omeros retains certain preclinical MASP-3 rights. The agreement highlights continued investment in complement pathway therapeutics, with potential implications for hematology and renal indications. Stay ahead in hematology research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for